edition of Dr. Twyman's Ask Me Anything. I'm a heart attack and stroke prevention expert, board certified in cardiology, and I focus on the early detection of atherosclerosis. So basically try to help people not have heart attacks and strokes. So I've been doing these IG Ask Me Anythings every Monday, 6 p.m. Central Time for the past 4 years or so. If you're ever looking for the archives, they're going to be on my YouTube channel, which is just drtwyman.tv. Quick update for the week. I did release some information in my newsletter as well as my story last week about the heart attack and stroke prevention summit I was on with Dr. Wolfson and all of his experts. So the conference, I believe, is still going on if you're interested. But at this point, my talk is now behind a paywall. So if you're interested in ever listening to my talk again, there is an option to acquire the videos if you're actually interested. But if not, no worries. I'll be on some other podcasts pretty soon. Did 2 podcasts in the past week. I don't know yet when they're going to drop. I did one on last Friday with Oksana from the quantum kind of biology world. Her Quantum Lens podcast was going to be launched soon, and I was chatting about cardiovascular health and the quantum biology world. And then I did a podcast with my friend and colleague, Amy Stuttle from over at Victory Men's Health. Today's topic was all about heart rate variability and some of the other interesting metrics you can look at on Oura Ring. So if you're interested in that, check out her Women Want Strong Men podcast. I suspect that one will come out in relatively short order. So got a lot of great questions tonight, and so looking forward to answering those for you. If you have a question or comment, just drop them below. And we usually go for about half an hour, so here we go. So first question up tonight. 4 years ago, in one of my 4-pillar videos, I had said HIT was best for nitric oxide. A recent talk with Alexis, I said zone 2. Why change? Not exactly a change. Both forms of exercise can improve nitric oxide release. It's mostly about having flow over the endothelial glycocalyx that stimulates the underlying endothelium to release nitric oxide. 4 years ago, I probably didn't know as much about the glycocalyx, so I was thinking it was more going to require higher intensity to do that. So don't think it's necessarily a change. I just think any type of exercise that increases heart rate and increases flow can improve nitric oxide release from the artery. Why do I think of a medical device called AVACEN for microcirculation for cardiovascular disease? It's not a device I'm familiar with, so I'll have to try to do a little bit of research on it. But if you have any type of research that you want to share, just send me a link in the DMs, and I'll try to take a look at it. Next question, a 33-year-old who unfortunately had a heart attack. That's way too early. They went through an angioplasty. Looks like they had gout. Can you wean off medications? What supplements? This is something that would require a consultation with myself or a doctor who's familiar with your case. I can't make medication recommendations for somebody who's had a serious cardiovascular event like that. But the basics are you have to optimize nitric oxide pathways and support the glycocalyx. You have to check labs and make sure that all the oxidative stress and inflammation has been normalized, and then use whatever combination of often medications and lifestyle interventions to optimize the lipoproteins. So work on those 3 things, and you can reduce your risk of having another cardiovascular event. Okay. Somebody's asking about MTHFR mutations. So MTHFR, methyl tetrahydrofolate reductase, a long word for an enzyme that has an effect on methylation and detoxification pathways. They say they have a mutation in the gene. Do I have increased cardiovascular risk? Not necessarily. You said your homocysteine is at 8 micromoles per liter. That's usually the cutoff I'd like to see, is a homocysteine less than 8. There's different variants of MTHFR mutations. You can have 1 abnormal copy, 2 abnormal copies, 3 abnormal copies, or 4 abnormal copies. And you're going to have to look for the words homozygous or heterozygous to be able to figure that part out. But tends to be more a vascular issue if it's the 677 MTHFR gene versus the 1298 gene. Typically, the issue is that homocysteine builds up, has an effect on asymmetric dimethylarginine, or ADMA. High ADMA levels lower something called endothelial nitric oxide synthase, or eNOS for short. If you lower eNOS, you lower nitric oxide. If you lower nitric oxide, arteries get stiff, blood pressure tends to go up, lipoproteins tend to stick to the glycocalyx in the endothelium, and plaque tends to build up. So high homocysteine is associated with increased cardiovascular disease, but MTHFR by itself, not necessarily. Somebody's giving me some feedback. They wish they could be their doctor. I potentially could be. I work with patients from all over the country and have had patients from Abu Dhabi, Canada, and Australia fly into St. Louis to be screened at our practice. So if you actually truly want to be seen by us, I do still have some availability. I'm currently booking out at least 2 months into the future if you want a deep dive of your cardiovascular risk. But if you want to work with us, just go to my website, drtwyman.com. There's an application, and one of my team members will talk to you about the onboarding process and walk you through all the logistics on how you potentially could work with us to have your cardiovascular issues screened and treated by our practice. Can methylene blue be used to treat cardiovascular disease? Depends on what you mean by treat cardiovascular disease. Methylene blue can support mitochondrial function. The heart by volume is 40% mitochondria, so yes, it may help some cardiovascular conditions, but not all. And you need to work with somebody who knows what they're doing with methylene blue, because you can cause problems if you have certain genetic abnormalities or certain medications. So it's not something that everybody can take freely, and dose does matter with methylene blue. So somebody's asking, why do certain vaccinated patients get palpitations? Just likely an oxidative stress and immune response. It may affect the glycocalyx and nitric oxide being low. Multiple reasons. Next question, is it beneficial to breathe through the nose when exercising and produce more nitric oxide? Potentially. It's more when the kind of sinuses are resonating that the nitric oxide can be produced from the sinuses, but is it a major source of nitric oxide? Probably not. It's probably a better marker that if you can breathe through your nose with exercise, that you're better cardiovascular conditioned. The main ways you make nitric oxide is with the exercise flowing over the artery lining, and you get reactive hyperemia. When you're outside in UVA sunlight, and UVA sunlight hits your skin, nitric oxide is liberated from the exposed surfaces. So it's like a plant. If you keep a tarp over it, it's not going to grow. So if you have clothes on all your surfaces, nitric oxide is not getting released from the areas that are covered by clothing. And then at times, if you have a healthy oral microbiome, if you're eating nitrate-rich foods, the nitrates will eventually become nitric oxide through a process in the stomach. Is taurine good for someone who has mild atherosclerosis? Tend to see it more used for people with hypertension. Haven't seen that great of data that it has much effect on plaque characteristics. Is costochondritis a cardiac related? No, it's the inflammation in the intercostal areas between ribs. And can it be confused for angina? Absolutely. So if you have a musculoskeletal injury or inflammation, over the chest region, I've often seen patients come to the ER, complaining of chest pain. You're always going to rule out that it's, myocardial infarction with an EKG and potentially just listening to the story. But costochondritis, typically is going to be more chronic, does not wax and wane, and there's often an ancillary, a precipitating viral infection or something where they have an injury to that region. All right, somebody wants to hear my best tips on lowering morning cortisol for blood pressure control. cortisol may have an effect for that, but you would have to potentially do a adrenal stress index to really see the kind of peaks of cortisol, and does it appropriately drop with circadian kind of cycling throughout the day. Cortisol normally rises in the morning. It's depending on how high it's going. It might be a concern. So caffeine can drive it in some people. Blue light, so thus always wearing the blue blockers if there's any artificial light inside. And then we'll look at, how well is your sleep in general. If you're sleeping 7-8 hours a night, you should not be having surging cortisol in the morning. All right, so somebody's saying that they use an app that tells me the UV index and the correct time to get exposure to the sun for vitamin D, but I don't know what AAD is advising on getting D this way because it causes cancer. They're saying to get D from food. Well, most foods are not very high in vitamin D. Some mushrooms, some like fish eyeballs, liver may, but vitamin D is a hormone, and it's produced when the UVB waves of sunlight hit and interact with the cholesterol in the skin. The cholesterol is sulfated. That sulfated cholesterol goes to the liver. There's a process that goes on in the liver. It goes to the kidney and gets turned into the active form of vitamin D. So think of vitamin D blood testing as a surrogate for how much proper sun exposure you get. The sun in of itself does not directly cause the cancer. It's the issue with typically people having low vitamin D and they're living an indoor existence. Will HIT release stem cells that will regenerate damaged heart tissue? Unknown, possibly, but it's more about the mesenchymal stem cells in the sternum and the tibia. They get activated by infrared light, so that was shown in a trial in Israel. Patients having myocardial infarctions were treated with photobiomodulation during the procedure. 1 day later, 3 days later, and the stem cells that were activated had caused those patients to have smaller heart attacks. So light therapy is one of the drivers for it, and it's nitric oxide that is what's key to liberating stem cells. And so exercise liberates nitric oxide. Is there any way to be sure that chest pain is not due to clogged arteries, but is due to another reason not related to the arteries? Yeah, that's what a cardiovascular workup entails, is doing testing that looks at the health of the arteries. If you have endothelial dysfunction, you're more likely to have plaque in the arteries if it's long-standing endothelial dysfunction. If you have inflammation in the arteries, confirmed by blood testing or carotid endometrial thickness testing, you may have more plaque in your vascular system. But the only way to really know about your coronary arteries is do some type of test that would look at the coronary arteries. A non-invasive way would be a CT coronary calcium scan. It's not the test you should consider doing if you're having symptoms, but if your calcium score is 0, it's less likely you're going to have severe atherosclerosis or plaque in the arteries. If you have a calcium score over 300, then it's equivalent to you've already having a heart attack and you're high risk, and any chest pain is potentially more cardiovascular in nature. A non-invasive test that could also look at the arteries is a CT coronary angiogram, but that comes at more cost in terms of radiation. You have to have an IV, you have to have normal kidneys, you often have to take a beta blocker to slow the heart rate down, and then also the cost of the test, if you had to pay out of pocket for it, is probably going to be 15 times more expensive than a calcium score test. And then if people are having chest pain with exercise, then this is when it may be reasonable to do a stress test. Stress tests are good if people are having symptoms. You want to exercise. Can you recreate the chest pain? Are there EKG changes during exercise? Are there wall motion abnormalities on an echo or perfusion imaging on a nuclear stress test, then the chest pain is due to a cardiac cause if the stress is abnormal in that case. But the challenge with stress tests is if you don't have symptoms and you pass a stress test, it does not tell you do you have plaque or not. It just tells you don't have severe plaque in your arteries. And more than half the time when people have heart attacks, they have more mild plaques in the arteries that are not severe enough to cause them any symptoms, even with exertion. Why do I get irregular heartbeats every reading I take for blood pressure and consistently low blood pressure? The irregular heartbeats, often are premature atrial contractions or premature ventricular contractions, but you would need a physical exam and, probably an EKG to see what are the irregular heartbeats. If they're that persistent, if they're more intermittent, then a Holter monitor, which you wear for 24, 48, or 7 days would be able to catch what the irregular heartbeats are. And if you're having many irregular heartbeats, sometimes the monitors won't actually trigger effectively, and you'll get a false blood pressure reading. But normal blood pressure is 120/80 without medications. Optimal is 115/75. So it depends on what you mean by low blood pressure. If it's low and asymptomatic, probably not going to be too concerned about it. But if you're dizzy, lightheaded, then be more concerned about these, arrhythmias that might be driving the blood pressure lower. So potentially we need a workup to figure that part out. All right. So I think I got through all the questions thus far. So we'll hang out for a couple more minutes if anything pops up in here. But for those that are just joining, welcome. So my YouTube channel, drtwyman.tv, has all the archives of the previous Ask Me Anythings. I generally have them up there within a week of when they are live here. I run them through a AI tool, so it transcribes it, and also puts some of the subtitles in it. So if you're interested in watching these on replay or kind of searching through those to find a particular topic, go to the YouTube channel where you can actually see that. I was telling the other people who were on at the beginning that I did do 2 podcasts in the past week. I'll let you guys know when those drop, but one of them is going to be more about quantum biology in the heart. And then one of them I did today was all about heart rate variability and a lot of the data points that you can find on an Oura ring. All right, so there's a question that jumped in here. Are sardines totally safe to eat since they're canned food? Well, I mean, they are generally safe, but yes, it always depends on what type of canning process was utilized, and what is the carrier fluid. Is it water or oil? So it depends on, if it's a high quality brand, they're going to probably use 100% virgin oil. If it's an unknown brand, you would not know if they're cutting with vegetable oil. So it does matter what the carrier fluid is. And you would not want to have a kind of off-name brand where you don't know what kind of metal that they're putting the fish into. But generally, sardines are a good source of omega-3, and I have tried them on many occasions, and I have some patients that's their main source of getting omega-3s 3-4 times a week. Is the heart's function and the gut's function related to each other? Yes, through the vagal nerve is probably the main way that they're connected. How do you get my newsletter? If you go to my website, drtwyman.com, there's a opt-in box on that page. The newsletter, it's called Heart Attack Proof, Dr. Twyman's newsletter. It's on my agenda to be a little bit more proactive in releasing the newsletters. I've only released 2 in the past month, and then it had been many months since the last edition. But my goal is to at least have one good one coming out a month, and as time permits, I'll get more and more out. But if you're interested in the newsletter, that's where I'll release updates on any podcasts I've been on. If I'm planning a retreat in the fall at the Canyon Ranch in Arizona, so if you're interested in that and want dates and information, the newsletter will be the main place that information is disseminated. I submit a question. Are palpitations a nitric oxide issue? At times they may be. So the microvascular system is 99% of the flow of your blood. If you can't get oxygen nutrients into the heart tissues, you may have these palpitations. So sometimes that is the root cause, and so that's what we test in our practice. If you're low in nitric oxide, we treat that. All right, so it says Dave Asprey takes 5 milligrams of tadalafil daily for nitric oxide production. What are my thoughts? Dave is a biohacker, and Dave does a lot of things that are not necessarily standard of care. There are some preliminary data that these type of medications may help reduce Alzheimer's. The way that I talk about these medicines is that there's a time and place for them, but it does not cause nitric oxide production. So that is a myth. What they do is they keep nitric oxide around longer. So I often talk about thinking about nitric oxide filling up a funnel. You have to fill up the funnel with nitric oxide by exercising, getting blood to flow across the glycocalyx, UVA sunlight hitting your surfaces, and nitric oxide being released with UVA sunlight, nitrates from foodstuffs. If you put nitric oxide into the system, or you put nitric oxide supplements in the system, then with medications like tadalafil or Viagra, those are the phosphodiesterase inhibitors, they prevent the breakdown of nitric oxide. So instead of nitric oxide kind of being quickly metabolized, it just holds around longer, so it will continue to vasodilate the arteries. Now, there's some data that these medicines will also help with people who have kind of more recalcitrant hypertension. That's what they were initially studied for. But there is a side effect profile with these medications. Some people have vision changes. Some people have headaches, migraines. There is hearing loss associated with these medications in some guys. So they're not benign for everybody. So pros, cons, it depends. I definitely do not recommend this for everybody, but there are certain individuals that I use this in for who have significant vascular disease. And somebody just asked, what treatment do I do for boosting nitric oxide? I just went through those, but there's often times and places, to check biomarkers and figure out what is the root cause of the low nitric oxide. Is it a NOS3 gene? Is it a MTHFR mutation causing high homocysteine? Is it high uric acid because of uric acid being high because of too much alcohol, too much fructose? Then, if people still can't get things optimized, then that's when nitric oxide lozenges or long-acting capsules that help the body make nitric oxide are utilized. All right. Well, we're getting to the bottom of the hour, so I'll wrap it up here in just a moment. I'll save this to my archives in the short order, and it'll be up on my YouTube channel within a week. Last week's is now live. And again, once I hear when these 2 podcasts I did this week get released, I'll release them in the stories. If you're interested in my newsletter, send my website, drtwyman.com. So I appreciate your guys' time and attention as always. I'll be back next Monday, 6 p.m. Central Time, and help you reduce your risk of having a heart attack or stroke.